Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Hematocrit Hct blood test. A Hematocrit Hct test, also known as the packed cell volume, PCT, measures how much of your blood consists of red blood cells. /R/N/R/N red blood cells carry oxygen from your lungs throughout your body. A low HCT could be due to anemia, a vitamin or mineral deficiency, or blood loss. Having too many blood cells could be a sign of dehydration, heart disease, or polycythemia vera, PV. /R/N/R/N This article explores the purpose of the HCT test, the way in which this simple blood test is done, and how results are interpreted by your healthcare provider. /R/N/R/N illustration by Michela Buttignol for Verywell Health /R/N/R/N red blood cells, also called erythrocytes, are important for distributing oxygen from the lungs to the rest of the body. The percentage of your blood that consists of red blood cells also indicates the viscosity, thickness of blood. /R/N/R/N a high or low result on an HCT test can, /R/N/R/N an HCT test is usually ordered as part of a complete blood count, CBC. A CBC provides information on the three major types of blood cells. /R/N/R/N other tests may be performed at the same time as the HCT test or as a follow-up to help with a diagnosis. These may include /R/N/R/N as a basic blood test. The HCT doesn't require fasting or special considerations. Blood is drawn from the inside of the elbow or the back of the hand. With infants and young children, it may involve a small puncture in the heel or fingertip to collect blood onto a test strip. /R/N/R/N Once your blood is collected, it's placed in a centrifuge or an automated hematology analyzer instrument. /R/N/R/N The centrifuge separates the red blood cells from the plasma, noncellular liquid, white blood cells, and platelets, giving a direct measure of the percentage of RBCs in the blood sample. /R/N/R/N automated instruments determine the hematocrit, a calculated value, using various methods. Different ways instruments measure /count cells include /R/N/R/N whichever method is used, the hematocrit is calculated from the RBC cell count, RBC, mean cell volume, MCV, and the total sample volume, RBC x MCV/10 equals HCT. /R/N/R/N age and gender affect hematocrit level, but general guidelines for normal levels in adults and young children are as follows. /R/N/R/N HCT test results may be affected by factors such as /R/N/R/N Your healthcare provider will take these factors into account when interpreting the results. /R/N/R/N If your hematocrit results are outside the normal range, your healthcare provider may have you come in for additional blood tests to help diagnose the cause. Your healthcare provider may want to repeat the HCT test after weeks, months, or at least annually to monitor your levels. /R/N/R/N An above normal HCT means you have too many red blood cells, polycythemia. Symptoms of high HCT levels include /R/N/R/N high HCT levels are usually caused by an extended period of low oxygen in the blood. It is often a sign of dehydration. However, it may also indicate a more serious health concern, such as /R/N/R/N a low hematocrit number means that your body doesn't have enough red blood cells in your blood. This is also called anemia. Symptoms of anemia include /R/N/R/N anemia may be due to the following health conditions. /R/N/R/N anemia can also be a side effect of cancer treatments, such as chemotherapy and radiation. Hematocrit results enable healthcare providers to manage anemia if it develops. /R/N/R/N for men, An HCT level of less than 41% is considered anemic. For women, that number is slightly lower at less than 36%. The number varies for children depending on their age. /r/n/r/n If your HCT levels are abnormal, your healthcare provider may order additional tests to identify and treat the underlying cause. /r/n/r/n For example, if test results point to a bone marrow problem, a bone marrow examination may be needed. A sample of bone marrow is taken, usually from the hip, to check for lymphoma and similar disorders. /r/n/r/n In addition to treating the underlying cause, your healthcare provider may recommend diet or lifestyle changes, supplements, or medications. /r/n/r/n If your results, along with other tests, indicate that you have iron deficiency anemia, you can usually improve your red blood cell count by fortifying your diet with iron-rich foods. /r/n/r/n Some examples of iron-rich foods include /r/n/r/n Your healthcare provider may also suggest taking over-the-counter iron supplements. If iron deficiency anemia is severe, a blood transfusion may be needed. /r/n/r/n If anemia is the result of a bacterial infection, you may need to begin antibiotics. /r/n/r/n If you have a condition that causes overproduction of RBCs, your healthcare provider may suggest lifestyle changes such as quitting smoking or adopting a heart-healthy diet. /r/n/r/n Sometimes dehydration can cause high hematocrit levels. In this case, drinking lots of fluids can bring your levels back to normal. /r/n/r/n In the rare case of PV, a healthcare provider can provide medication that will help you manage the condition, but it cannot be cured. /r/n/r/n A hematocrit test gives your healthcare provider important information about your health. The test measures the volume of red blood cells compared to the total volume of your blood. /r/n/r/n The HCT test can help to diagnose or monitor blood disorders, dehydration, nutrient deficiencies, blood-related cancers, and many other conditions. /r/n/r/n If your test results are abnormal, other tests may be performed at the same time or afterward to help identify the cause of anemia, low hematocrit, or higher red blood cell counts, so you can get the right treatment. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.